Imagine a busy clinic in a small town, lines out the door, nurses rushing, doctors stretched thin, and families waiting anxiously for hours just to be seen. The air is thick with worry and every minute feels precious. Inside, equipment is in short supply, medical tools are often outdated or missing, and healthcare workers must improvise with what little they have, making do in the face of overwhelming need. But now, something remarkable is happening. A nurse pulls out a tablet, not for games or social media but to check a patient's heart, right there in the clinic. With a few taps, she can access information and run tests that once required expensive machines. Another worker uses a smartphone device to scan a child's finger for disease, no needles needed. The child smiles, relieved as the test is quick and painless. Technology turning fear into hope. This isn't science fiction, it's happening right now, in real clinics thanks to grassroots innovation and the determination of local heroes who refuse to accept the status quo. These solutions don't come from billion-dollar labs but from people who know the struggle firsthand, nurses, students, and inventors who see the challenges every day and decide to act. A student watches his grandmother travel hours for a heart check, worried every time she leaves. He wonders why care can't come to her, instead of the other way around. Another, tired of painful malaria tests, dreams of a better way, one that doesn't involve needles or tears but uses technology to make diagnosis gentle and fast. These innovators are building bridges, not just gadgets, using everyday tech to close healthcare gaps, connecting patients to care in ways never before possible. For them, a smartphone isn't just a device, it's a lifeline, a tool that can save lives and bring hope to entire communities. The most powerful ideas are born from necessity, from living with a problem every day and refusing to give up until something changes. This personal connection fuels late nights, new skills, and relentless determination. It's the spark that keeps them going even when the odds seem impossible. Across Africa, a new generation isn't waiting for help, they're creating it. They're learning, experimenting, and sharing ideas, determined to make healthcare better for everyone. Our story begins in communities needing heroes, not boardrooms. It's about ordinary people rising to meet extraordinary challenges. Meet Arthur Zhang from Cameroon and Brian Gitta from Uganda, two young inventors who saw suffering and decided to do something about it. They didn't have fancy degrees or endless resources, just vision, empathy, and belief in their community's potential to solve their own problems. They faced heart disease and malaria and chose to fight back with ingenuity, using what they had to create what was needed. This is their story, how simple ideas, powered by passion and persistence, can change the world. Let's see how these young innovators are transforming healthcare one device at a time. In Cameroon, rural healthcare is a daily struggle, especially for those suffering from heart conditions. The vast distances, limited resources, and shortage of specialists make even basic care a challenge for millions. Imagine your father or mother suddenly needs a heart specialist, but the closest one is far beyond reach. The nearest cardiologist might be hundreds of kilometers away, separated by rough roads and unreliable transport. For many families, the journey is not just difficult, it's nearly impossible. The cost, the time, and the physical toll are simply too much. Arthur Zhang, a young computer engineer from Cameroon, saw this struggle in his own community and across the country.
I wasn't a doctor, but I saw the problem every day. People were suffering, not because we lacked knowledge, but because we lacked access.
Cameroon had fewer than 50 cardiologists for over 20 million people, most of them concentrated in just 2 major cities, leaving rural areas underserved.
I knew I couldn't create more doctors overnight, but maybe I could find a way to bring their expertise to the people who needed it most, no matter where they lived.
Arthur's motivation was deeply personal. He had witnessed preventable deaths, not because of a lack of medical knowledge, but because of the sheer distance between patients and specialists.
What if a nurse in a remote village could perform a heart exam with just a simple device and send the results instantly to a cardiologist in the city, who could then advise on treatment right away?
This question became Arthur's obsession. He immersed himself in medical research, spoke with doctors, and listened to patients' stories. He began building a solution from scratch, working late into the night, determined to make a difference.
I envisioned a device so simple that any health worker could use it, even in the most remote village, but powerful enough to capture real, reliable heart data that could save lives.
It was an ambitious dream, one that many thought was impossible for a young engineer with limited resources. But Arthur was driven by a sense of purpose and hope for his people. He wasn't just building a gadget, he was determined to mend a broken link in the chain of care, to bridge the gap between rural patients and life-saving expertise. His journey would go on to change healthcare for millions, offering hope where there was once only despair. And it all began with a single powerful question: how can we bring the heartbeat of care to every corner of Cameroon? Arthur Zhang invented the CardioPad, a medical tablet for rural heart exams.
It uses wireless electrodes and a tablet to record heart signals. Any trained nurse can use it.
The genius: connectivity. The ECG is sent via mobile network to a city cardiologist who sends back a diagnosis, often within minutes.
No more days of travel. The information moves, not the patient.
Arthur made the CardioPad affordable using common components to keep costs low.
It's a fraction of the price of traditional ECG machines.
Now even small clinics can access life-saving technology.
For the first time, I got my heart checked in my village. My family was relieved.
The CardioPad empowers health workers and brings peace of mind to families. Arthur didn't just invent a device, he built a bridge of hope. A simple idea changing lives. And it's only the beginning. Let's see what happened next. The CardioPad's impact spread, and so did Arthur Zhang's story. He won global awards and stood before world leaders sharing how his idea saved lives.
I used prize money to improve the device and train more health workers.
For Arthur, the real reward was seeing the CardioPad in remote clinics. His humility kept him focused on his mission. Arthur's story challenged the old narrative. Africa isn't just a recipient of aid, but a source of innovation.
Arthur inspired me. He made me believe I could make a difference too.
He proved world-changing ideas can come from anywhere. Arthur became a symbol for a new generation, building solutions for their own communities. His journey is a lesson in purpose-driven innovation. He wasn't after fame or profit, but real change. The global recognition was just a bonus.
The true prize is helping my people.
Arthur's work shows that the most profound impact starts at home, and his story is far from over. Now let's travel to Uganda, where malaria is a daily battle. Transmitted by mosquitoes, malaria devastates millions, especially children. The standard test? A needle prick, blood sample, and a wait for results.
It's invasive, scary for kids, and not always available in remote areas.
Many self-medicate without a diagnosis, fueling drug resistance.
My friends and I saw this and thought, there must be a better, faster, less painful way.
Like Arthur, Brian Giddo was a young, tech-savvy insider who understood the problem deeply. They weren't outsiders, they lived the struggle.
We believed technology could offer a new path.
Brian decided to take on malaria diagnosis with a bold idea, not with despair but with innovation. And it all started with a personal fight. Let's see how. For Brian Giddo, malaria was personal. He'd suffered from it many times.
I felt the needle prick for blood tests more times than I can count.
The fear of needles kept parents from testing their kids. In remote villages, people often guessed or did nothing.
My team and I at Makerere University all knew this pain.
They brainstormed. Could they detect malaria without blood? Maybe with light or sensors?
It sounded impossible, but our personal connection kept us going.
They weren't after grades or prizes. They wanted to solve a problem that hit home. Countless hours, failures, and experiments followed. But their determination never wavered.
Every setback reminded us why we started.
Their personal fight became a fight for everyone, and then they found a breakthrough. Brian and his team invented Matibabu, a groundbreaking device that detects malaria without needing a single drop of blood. Their vision was simple: make malaria testing accessible, fast, and painless for everyone, especially in places where traditional healthcare is hard to reach.
The device clips onto your finger, shines a red light through your skin, and scans your red blood cells for subtle changes caused by malaria. There are no needles, no discomfort, just a simple scan that anyone can do, anywhere.
The process is completely painless, non-invasive, and takes only a few minutes. Results are instantly sent to a smartphone, making it easy for health workers and families to get answers right away, even in the most remote areas.
Now, a mother in a remote village can finally get answers for her child. No more waiting, no more fear of needles, just quick, reliable results that bring peace of mind.
Matibabu is lightweight, portable, and reusable. It doesn't require a doctor to operate, so community health workers can use it with ease, bringing vital diagnostics to people's doorsteps. With Matibabu, health workers can test entire communities, track malaria hotspots, and help stop outbreaks before they spread. It's a game changer for public health.
The device also helps prevent drug resistance by ensuring that only those who truly have malaria receive treatment. protecting the effectiveness of life-saving medicines.
Matibabu empowers individuals, health workers, and even governments to make smarter decisions about healthcare and disease control. It's more than just a gadget. It's a revolutionary tool for delivering smarter, faster, and more effective healthcare to those who need it most. Brian and his team reimagined what a medical test could be, blending innovation with compassion and a deep understanding of local needs. They brought healthcare directly to the people, breaking down barriers and making sure no one is left behind. No pain, no delay, just answers, hope, and a brighter future for families everywhere. Their innovation opened a new frontier in the fight against malaria, inspiring others to dream bigger and push boundaries. And the world took notice, celebrating a breakthrough that's changing lives across the globe. Like Arthur, Brian and his team soon found themselves in the global spotlight. Matibabu won the Africa Prize for Engineering Innovation, validation from the world.
It proved our idea, born from personal experience, was world-class.
The recognition brought hope and inspired a continent.
Matibabu showed us we could create our own solutions.
The device leverages Africa's high mobile phone use, leapfrogging traditional barriers. It's a model for decentralized, accessible healthcare.
It's a beacon for tackling other health challenges.
Matibabu's success sparked a wave of innovation. Brian and his team didn't just invent a device, they lit a fire. They proved a small group can inspire a generation and save millions. Arthur Zhang and Brian Gitta's stories are more than clever inventions. They're a blueprint for progress.
I saw heart patients struggle and built a bridge to doctors.
I felt malaria's sting and created a painless way to fight back.
Their journeys show that necessity, passion, and persistence drive real innovation.
It's not just about ideas, it's about courage and grit.
They're role models for a new generation, proving young Africans can compete globally.
They changed the mindset from, what can the world do for us, to what can we build for ourselves?
Their legacy isn't just devices or awards, it's hope and inspiration.
With ingenuity and heart, a few determined people can heal a nation and inspire the world.
Their work is a powerful, uplifting chapter in the story of human progress, and it's only the beginning.